right? So I think on a overall, we're just trying to look at the overview of disorders of carbohydrate metabolism, like just an overview of it, you understand? Just talk about all the concepts briefly, you get, and all of that. So for the carbohydrate metabolism, of course, you just have to do it. Carbohydrate breakdown and use is not going on as planned, you understand, as a deal should be. So we have said that disorders of carbohydrate metabolisms, they're actually conditions that affect the body's ability to be able to process carbohydrates. Now, carbohydrate is essential for energy production. So those whole disorders can be classified into the ones that are acquired, the ones that are inherited. So for the acquired one, we have things like diabetes mellitus, which we have already spoken lengthily on diabetes mellitus, even the pharmacology of diabetes mellitus. That's drugs that are used in treating diabetes mellitus, right? So type 1, there's no insulin production, or insulin production is insufficient. While type 2, there's insulin production, but the cells are not responding to it. You get? Hypoglycemia just have to do with low blood sugar levels, all right? Maybe there's excess insulin, so it's breaking down too much of the glucose too fast, or probably fasted, or probably have some certain medical conditions, all right? Or you're taking some certain medications, you get? So you'll be dizzy, you'll be confused, you might even faint because, all right, no energy. The diabetic ketoacidosis, all right? So there's high blood sugar levels, ketone production, metabolic acidosis, right? Usually complicates the kidney. Is diabetic ketoacidosis. So you can pause to look at the signs and symptoms. All these conditions we have already spoken about them though. Then inherited disorders, we have examples like glycogen storage diseases, like the Gierke, like the Pompe, so I've already spoken about them. Then we have the galactosemia. It's a rare condition where the body cannot metabolize galactose, so it will now lead to toxic accumulation of galactose, right? Hereditary fructose intolerance, even lactose intolerance, all those things, right? So the enzymes that are needed to break down these types of glucose are not there, all right? So you now have like a backlog. I understand the glucose is not being broken down, so you have a backlog of it in the blood. You get? The lactic acidosis is just buildup of lactic acid due to defects in carbohydrate metabolism. Right. So by and large, basically, if you want to diagnose, just blood tests, genetic testing, because you want to see if there's any genetic mutation, metabolic studies. All right. So management just depends on the specific disorder. Okay. Like what's happening, you get. All right. If an enzyme is missing, you just replace the enzyme, give some medications, and all of that. Okay. So that's it.